Hey guys, I'm Paul Lynch. I am an anesthesiologist from Scottsdale, Arizona, and today I'm lucky to be here with my lovely wife, Jan Lynch, who's a dentist, and her amazing team at AZ Dentists. Could you tell us a little bit about why we should be thinking about sleep apnea?
Sleep apnea is a condition where you stop breathing at night and your oxygen levels drop.
Well, you got my attention already as an anesthesiologist, so your oxygen literally goes down while you're sleeping.
Yes, you are usually snoring and then your airway collapses and you stop breathing and yeah, it's a big deal.
So we're going to come back to that. Would you introduce yourself, Joanna?
Hi, I'm Joanna, and I'm the hygienist here at AZ Dentists, and I feel like I have a crucial role in helping patients pre-screen for some airway conditions.
And you also work as the sleep coordinator here also.
I sure do.
Awesome. I'm excited to hear more about your role. And then we also have Bea. Would you tell us a little bit about yourself?
Hi, I'm Bea. I'm a family nurse practitioner. You're probably wondering, what am I doing at AZ Dentist? But we are in a unique position where we have medical and dental under one roof, and our goal is to help patients understand when they are not breathing and how we can give their lives back by literally just opening up their airway.
And you were telling me earlier, you used to work in the ICU, so you kind of understand firsthand if the oxygen drops on a patient, that's a pretty big deal.
Yeah. Luckily, we're not in this setting, but in the ICU, we just have damage control. By the time we get a patient in, we're doing everything and anything we can to keep that airway open. In this space, we are looking more in the preventative area. That way, we do not see you in the ICU, and we're trying to do everything and anything we can. So
I was blown away by how common sleep apnea is. How many patients have sleep apnea?
You know, in the United States, it's about 1 in 4.
So literally, one of us
Well,
will have sleep apnea.
So 1 in 4, that's insane. A lot of patients are walking around with this, and they probably don't know.
No, they don't. I think you just get progressively more tired and you think maybe it's old age.
And where does the dentist come in? Are you guys seeing this sometimes and making the diagnosis, or?
We'll see really telltale signs in your mouth when you come in for an exam that will lead us to have a strong idea that you are suffering from sleep apnea.
And my understanding is, as a dentist, you can't really make the diagnosis, but you've expanded your team here to bring medical providers on to help with diagnosis. Is that right?
That's correct. Because it's 1 in 4 people, we have added Bea to our team so that when we do suspect a diagnosis of sleep apnea, we can have our patient see Bea and she can help diagnose.
Yeah. I really like that at AZ Dentist, we are able to just have like a one-stop shop. So you guys do see patients a lot more than patients see their doctors. And so you guys are able to see those telltale signs from a dentist perspective. And then if we do need to further screen them, then I jump in and I take the ball and we work as a team and see what's, the best treatment for them.
Joanna, you've been a hygienist, I won't say how many years, but for a while. And you were telling me, like, you see signs in the patient's mouth that they might have sleep apnea. Is that true?
Yeah, we see a lot of signs of sleep apnea. The tongue can be scalloped, which is an indication that they're trying to get some air. Clenching and grinding, wearing of their teeth is all major indicators that the patient has some form of an airway disorder. So it's really great opportunity because patients come to the dentist more frequently than they go to their doctor. And so we can have a key role in this intervention of helping to save lives, not only just teeth.
That happened with me. I had no idea I had sleep apnea. I think Jan might have said that I snored every once in a while, but it wasn't really the snoring that was the big symptom. When I went to the dentist, you guys told me that I had grinding the back of my teeth. You could see signs of sleep apnea, and I didn't really believe it. And then I got tested and found out that my oxygen was dropping at night. And sometimes my oxygen would drop as low as, I think it was 72 or 73%, which is an anesthesiologist.
Yeah.
Like, that scared me. Like, that's why I'm not as sharp.
We need to intubate you right
now. But Bea, so when you're working with a patient, what are the kind of symptoms someone with sleep apnea might have?
So they're definitely just like generalized symptoms of daytime fatigue. They're sleepy. They don't have any energy. A lot of the times patients do have chronic pain and they think, oh, it's because their pain, kept them up at night. Patients that have depression and anxiety, that cranks up so much faster and so much higher when they're not getting enough oxygenation, and their sleep apnea takes over at night.
And there's some bigger ones too that make me anxious as a doctor. Hypertension is really common, or high blood pressure with sleep apnea. Cardiac events like sudden cardiac death is one of the most common ways that people die from this disorder. Obesity, it's like obesity can cause sleep apnea, but sleep apnea can make the weight gain worse, right? Are there other things, Jan, that come to mind on like medical conditions that these patients get long term?
It really messes up your hormones if you can't get into your correct sleep cycles. And so long term, you've got a higher risk for Alzheimer's disease. And then just because of the oxygenation and what it does to your blood vessels, a higher risk for stroke.
Wow.
So cancers.
Right. And diabetes, like which I didn't know about until I started researching this more. A lot of these disease states are made worse by sleep apnea, which kind of brings us back. You mentioned pain. So you've been in the pain space for a long time. Could you tell us more about the interaction between pain management and sleep apnea?
So it's actually interesting to see this perspective, because when I see patients as a pain provider, I just tunnel vision on their pain. And for the most part, when I'm looking at health history, we're unable to treat their pain because they have high blood pressure. I've had to turn down patients to getting any, spinal injections because their blood pressure is not being treated. And a fun fact, so if a patient has 2 to 3 blood pressure medications, for the most part, they have undiagnosed sleep apnea. They will, they'll go. It's very frustrating from their perspective, because they keep telling us like, oh, I've gone to my primary care. They don't know what's going on. I've been, back and forth with different medications, but I think I want to say 40 to 50% of those patients that have 2 to 3 blood pressure medications, most likely they will have sleep apnea.
I find from the patient's perspective that in the medical world, sleep apnea is an uncommon thing to screen for.
Right.
The medical doctors are very opted to treat the condition and give a script and treat your blood pressure and treat your diabetes and treat your high cholesterol. But it's like, what is causing them to go tenfold and be on 3 medications?
And I really, what I want to tell or to say to our patients is that I want to make sleep study be like an open narrative. Like, I want that to be the new narrative, instead of, like you said, just like pushing it aside. Let's just simply screen you, and if you don't have it, you don't have it. But if you do, not being able to breathe at night, it's insane. It's like you need oxygenation to feed your body. Otherwise you can't function.
Yeah, and it's not like, these conditions that you have, like pain, that's not like it's going to go away overnight if you treat sleep apnea. That's not what we're saying. But we're saying, like, if you're exhausted during the day, you can't cope with the chronic pain syndrome.
No.
And it feeds into it. So it's a piece of the puzzle.
Right. And you can't, your hormones can't get regulated. And like you had mentioned before, the obesity, when you aren't getting into your deeper sleep stages, your body does not produce the hormones that tell us that we're full. So we just eat and eat because we don't get those releases of hormones because we aren't getting the amount of oxygen in the sleep stages that's necessary.
So it's not like your weight's going to drop off. If you get your sleep apnea treated, you're still going to have to work on it, but it's going to be easier.
It's going to make it
It's not going to be impossible anymore.
Our body can work more naturally of how it's supposed to work.
So you guys have said several times between you that you need to screen a patient. I bet there's some people at home watching thinking, I might have sleep apnea. I thought it might be helpful. One of the things that we teach is what's called the stop bang test. And we do that in all of our clinics here. If you come in, it's 8 questions. And I just want to walk that through with you. So it's STOPBANG. So the S, what's that stand for?
Snoring.
Snoring. So is that one of the best indicators that someone has sleep apnea?
Yeah.
It's a good indicator for sure.
And so a patient can ask their partner or ask someone, they usually
Yeah.
know, right?
Yeah. So S is snoring.
Yeah.
O or
Well, T.
Sorry,
Yeah.
T is being tired.
That's it.
O is where I was trying to go with this. This is where your sleeping partner would observe whether or not you're gasping for air or you're snoring or you're
So
interrupting their
observed.
sleep. Observe.
So your
Yep.
partner's involved in two of the top three, right?
Yeah.
Where are you snoring and did they observe you
Yep.
stop breathing?
Yep.
And then the P is hard to remember sometimes. It's pressure.
Pressure.
Right? So high blood pressure, that's one of the best indicators of
Yep.
sleep apnea. So then you go to the B, which is their BMI, right? Like, are they overweight? And so the BMI we use is like 30, right? And so that's the B. And then M is...
A.
Oh, sorry, B.
I was a spelling bee champion, so and I also messed up, so it's okay.
So A is what?
A is age. So
Where is it? When are you more likely to have it?
greater than 50 years old.
Yeah. So this is more common in our elderly folk. And,
Yeah.
and you have a couple locations out in the west side of town where there's a lot of retirees.
We do. And the reason that it's more common with the elderly folk is just not elderly. At 50, you're not elderly. But it's just that, you know,
Yeah, I know why you're saying that.
you everyone. I want to make that very clear. So, you know, you just start to get like wrinkles on your face and everything's more lax. And that happens in the back of your throat. So you just have more excess skin back there.
We had a patient talking about that earlier
Yes,
today.
it does.
That it happens on the inside of the throat, the same thing you're saying on the outside.
Right.
We lose collagen, we lose elasticity, and all of that internally and not only externally, but we see it. And as we lose all of that, the elasticity and the flexibility is being affected by our airway, and the airway is very tiny.
So let's go to N. What's the N stand for?
Neck circumference.
So big neck cirrhosis.
neck,
Can you
yeah.
tell us about that?
So if you're a male and your neck circumference is greater than 17 inches, or if you are a woman and your neck circumference is greater than 15 inches, you're more likely at risk to have sleep apnea. And that's an easy tape measure,
Sure.
2 seconds. We
And then
can
the
figure
last
that
one
out.
is G for gender. And I understand it's a lot more common in men.
Yep.
So a patient who's snoring at night, a patient who's tired all day, they've been told, hey, you stop breathing. That made me really scared.
Yeah.
They have high blood pressure. They're overweight.
Yep.
They're over 50, a big neck, and a man. If you have, 3 of those things,
3.
then you're likely to
Yeah.
have sleep apnea, correct?
Yes. And you know, for our men out there that might have this situation, I'll tell you, like professional football players, probably 90% of them have sleep apnea just because of their musculature.
Wow.
And so
I had no
that's-
idea it was that common.
Oh yeah, it's huge in professional football players. So somebody that's like a big
You know a lot more about football than I realized.
He's holding out on you.
Who's your favorite team?
The Bears.
The Bears.
Bear down. Do not bear down. That's no oxygenation. We don't like that.
But you know, a great question is when you have the observation.
Yep.
Some patients sleep alone. So one thing that we have found, you know, that those that are like, well, I sleep fine. I don't know if I snore. I don't know if I have this.
Right.
They have apps out there that you can record yourself, and it will let you know: do you snore? How loud is it? And do they have like a witness of maybe stopped breathing?
Yep.
So those are some things that we like to educate our patients that are single, because this can also be monitored or found out about it.
I think that's great advice. If you're not sure if you're snoring at night, just go on the App Store and search for snore. There's all sorts of apps that will look for that. And then I'll just say, as a quick side note, if you were listening to us go through the diagnoses there and you suspect you might have sleep apnea, go to our website at azdentist.com and call us, because it's quite easy to get in and we can help you with medical professionals figure out if you do have this diagnosis.
Right.
So now let's say there's a patient at home. They're like, I definitely have sleep apnea. I want to be seen. If they came in to see us, I'm going to start with Bea, who works on our medical division. How do you make an actual diagnosis of sleep apnea?
Yeah. So we will sit down. We will go over your health history. We will talk about your sleeping patterns. We will talk about your medications. how well you function during the day. These are the type of questions that you would be answering with the Stop Bang questionnaire and the Epworth sleeping scale. If you land in the scoring system where you are at a higher risk for sleep apnea, lucky for you, we have a different option now. In the past, you would have to go to a sleeping lab.
Wear all those wires
You
on
wear
your
all
head and
these
everything.
wires.
And people watch
There's like
you with
this,
videos.
this, yes.
So scary. I can't do that.
And you know,
bed.
and the weird bed, right? And yeah, and the thing is, the worst part about that is not even all those wiring. It's that you have to wait 2 to 3 months. My dad and my stepmom just, had to deal with that. But now with new technology, you are able to use like a little silicone ring.
Wow.
And it just, you wear it at night and you don't
And
do
do you
anything.
still have to go to this lab and all that?
No. You take this home. You take this home,
Wow.
and then you put this on just right before you go to bed, and then you sleep soundly, you snore however you sleep. You wake up and you actually put it on a dock the way you would like your iPhone or Apple Watch, and then it automatically downloads into our system for
Wow.
a preliminary result. And then we would send that off to a board certified sleep physician to confirm the diagnosis. And then we have you come back and we talk about different types of
And what
treatments.
are you looking at? What are the kind of outcomes we're tracking with that device?
Yeah, so there is, it's called apnea hypopnea index. So what we're looking at is how many times you're actually pausing from breathing or stopping from breathing in an hour.
Wow.
So anything over 5. So if you are having greater than 5 events in an hour, you're already considered mild.
I don't want any of it.
Yeah,
When
sleep
you say
apnea.
event, you mean I stop breathing?
You stop breathing.
And that happens
And
over 5 times an hour sometimes?
5 times an hour. It can last for a few seconds to actual minutes.
Wow.
And the ring can actually analyze how low your oxygenation goes and for how long.
The way that you score it is you have to drop your oxygen at least 4%.
Okay.
And you have to stop breathing for longer than 10 seconds.
That's a long
is
time.
considered one episode.
So
Wow.
if you're having less than 5 of those in an hour, you don't even have mild.
Okay.
But that seems crazy.
Right.
So
I mean, you have to stop breathing for 10 seconds. There's some that stop breathing way longer than that. And
What's the longest you ever saw someone?
86.
86 seconds. Wow.
well, no, sorry, 86 times
86
an
times.
hour.
86 times an hour they stop breathing?
Seconds they're having episodes.
I've actually
crazy.
seen greater than 100.
Greater than 100 in 1 hour they stop breathing.
30.
Yeah.
I
Yep.
can't imagine how someone could function like that during
You
the
do-
day.
you
if
do
they're
not.
breathing all night.
yeah, that's like where you get your neurologic.
You're a zombie at that point.
I don't think most of the people watching this realized how serious this condition was.
It is. It is. I mean, you're actually not breathing. And in order for your body to actually function, it needs oxygenation. It needs oxygenation to feed the organs. And that's why, high blood pressure happens, is because when you're not breathing, the brain tells the heart to pump more blood. And when it pumps more blood carries oxygen,
Yeah.
and therefore it oxygenates the body. But if it keeps having to tell the heart to pump and pump and pump because it's not breathing, your arteries are going to get messed
Wow.
up.
As an anesthesiologist, like you talked about how long you stop breathing, I get scared about that. Your oxygen dropping, of course, that's important. But one of the things about the reports I've looked at is the heart rate. Like when someone stops breathing, you'll see the heart rate go up
Yeah.
really, really fast, and then they gasp and breathe again, and then it kind of settles, and then the cycle happens again
Yeah.
and again. And so these people during the night, they're not breathing and their heart rate's going up, and then during the day, their blood pressure's higher. Like it seems to affect the entire cardiovascular system.
It does. I always say in the ICU, your body is always going to want to go back to homeostasis, to its home. So that's why when you're not breathing, your heart is pumping more blood and your heart rate is going. And that's why it's very important to treat this now, because what I've seen in the ICU, there are times when your body is like, it wants to do everything for you, but when you make it to the ICU, it's like it doesn't know what
Sure.
to do anymore. And we don't want that with any of our patients.
So a patient will come to see you, you'll give them this beautiful little thing on their ring, and within 1 or 2 days, go home, and then how long does it take usually to get the results back from the test?
Less than 24 hours.
Really?
Yeah.
And so just like that, a patient can find out if they have sleep apnea. And then what's the next step?
The next step is we talk about treatments. The gold standard for obstructive sleep apnea is CPAP.
Okay.
And it's a machine, whether it's a face mask or it goes into your nostril. What it does is it pushes pressure of air to pretty much open your airway.
Wow.
Not the most comfortable thing. A lot of patients are so non-compliant with it because it's bulky, it's heavy, they have to carry it, they have to plug it
They
in.
roll over,
They
their
roll
mask
over,
leaks,
yeah.
their eyes are dry.
Right. My dad literally said, I put it on and I woke up, it's on the floor. Like, okay, thank you.
I didn't know your dad has sleep apnea.
Yeah, my dad has sleep apnea. And so what we are able to do here at AZ Dentist is we can see if you are a good candidate for an oral sleep appliance, where we work with Dr. Lynch and Joe to create a very customizable, essentially like a mouth gear to help open up your airway, and kind of looks like this.
Let's have Joe tell us a little bit about,
Right.
so let's say we send the patient over to you, Joe. What's the first thing you're going to do to kind of, I understand you guys map out the airway, or I don't know how you say it exactly.
So yeah, we have some newer technology that we're able to assess your airway. We have a machine called the pharyngometry. What it does is it's going to let us check the flexibility of your airway,
Okay.
and let us know how collapsible it is. About eight out of 10 patients, it works great for.
Okay.
But there are some that it does not work great for. And it just kind of lets us screen and see it, and then we're able to manipulate your airway, because we can't go home with you at night. We can't sleep with you, and nor can I know how your airway is going to work, because everybody's airway is so different. So this technology lets us precisely be able to measure your airway and how to precisely make a sleep appliance.
So let's say you're one of the 80% that it works. That means that this device that you guys make will keep their airway open at night?
Yeah, so it'll keep your airway nice and taut, so that when you do lay down, your airway stays open and you're able to get natural air.
That sounds like a big advancement in the technology. And I understand, Jan, that not every practice does it that way, but you guys have invested in this equipment because you can, you know that it's working.
Yeah, we know that it's working, and there are places where the sleep apnea is happening, where your airway is collapsing.
Got it.
It can happen in your nose, and you sleep with your mouth closed. Well, if it's that situation, you need to see your ENT. Where we're treating it is if it's happening right here at the back of your throat. It can also happen a little bit lower down above the epiglottis. If it happens down there, then you can put an oral appliance in and it's not going to affect it. But we're going to know that with our technology before we attempt it.
So you know that you're giving the patient the right treatment, which is interesting. One of our patients earlier was talking to us about this other procedure you do when the tissue gets lax. Could you tell us about that?
Yeah, we do have a laser called the Photona laser, and it does a procedure called night laze.
You have lasers in this clinic?
We have lasers in this clinic. That laser does so many wonderful things. And if you're familiar with like facelift stuff, if you're older than 50 and you're a woman, you probably are familiar with some of this stuff like Fraxel. So this laser is like a Fraxel laser, a resurfacing laser, and we use it in the oral cavity and in the back of the throat, and it just tightens all the tissue up.
Wow. And it works.
And it works. It works tremendously.
It helps stimulate our own body to produce collagen. And so with more collagen, we have more tight tissue, which means our soft palate is nice and tight and strong. So it's not going to sag when we sleep.
So
You guys are doing a great job explaining this. I didn't understand all this today until you started teaching it. So it's tightening up the tissues. And then do you do both treatments sometimes? Do some people need the tightening and they need the oral appliance?
well, sure. I think that tightening of the tissue goes a long way. It's not a overnight cure. We do one treatment for every decade of life, and they're 3 weeks apart. But we're doing that because it's building on each other. It's building that collagen back up and making everything smooth and taut in your airway, so you have less tissue to collapse and
But as we age, everything kind of also ages. So it's not one and done. It is a maintenance program. So once you get your, however many treatments you need, the maintenance is about every 6 to 12 months for a couple.
I'm glad you brought up maintenance. I think it's a nice segue to our next section, which is talking about how do we manage this over time. We've kind of walked through, now you have your appliance, and I want to talk a little bit about like how to maintain it. But Joe, could you just tell us a little bit about, like, there's like this transition period to make sure it's working well, right?
Right. So it takes about 6 to 8 weeks for the patients to get their appliance to its optimal position.
Okay.
And every patient is different, and every patient, there is no magic number of how many turns that we're going to use or what band length we're going to use.
Could you tell that again, the turns? Are you actually dialing in the right amount of
Yes,
opening
so
on the
we
jaw?
are going to be moving your jaw a little bit forward at increments at a time.
Okay.
Because we have so many moving parts and ligaments and joints.
Is this painful?
No.
Not at all. Okay.
So we get to move the appliance at 0.2 millimeters at a time.
Wow.
So it's very small, and we only do about 2 turns a week. So once the patient starts to feel better, sleeping through the night, dreaming, no more snoring, then we know we're in the right direction. We can overturn and overcorrect. So if we go too far, the patient will start to snore again and have issues. So then
Interesting.
we know to back that appliance up. So it takes about 6 to 8 weeks for us to get to that point. Once we get to that point, then this is where Bea would come in, and then we would treat with a sleep study.
Yep. That would be the time where we have you take home one of the rings again. We just want to make sure that we are in the right space in your mouth and that we're also treating your oxygenation.
Yeah. And have you ever seen it get worse on the follow-up? Is this something?
That is a possibility.
Yes, I think sometimes people, your airway in regular sleep apnea is collapsing like this, but the way that we're different, this is obviously very complicated.
Yeah.
There are things you can order on the internet. I've had patients say, I treated that with something off the internet. But patients will think, oh, if I just make that go as far forward as I can, then it's going to do everything it needs to do. But instead of collapsing like this, you're going to start to collapse like this.
Wow. It sounds like a very nuanced approach that you have at AZ Dentist,
Yes.
which got me really excited as I was talking to you and your team, that you're really treating this disease and not just giving them another device that's going to be on an
It's not a night guard you're going to wear and, all right, we're done. We have a maintenance program here at AZ Dentist that we really try to follow up and keep our patients, making sure it's working. Patients come and see us twice a year. You're already coming to get your teeth cleaned. So we have the patients bring their appliance. Dr. Lynch has invested in some great stuff that we're able to clean the appliance, make sure it's working. There are warranties that come with this appliance. So if we can inspect it and we start to see some issues, we can get it addressed with the lab immediately. And then we can make sure that, Dr. Lynch is checking teeth, making sure the teeth are still stable and we have a great foundation for our appliance, and that we're able to make sure that if we start to suspect that it's not working, Bea can jump in and we can definitely start to make sure that our patients just are thrown a device and then they're on their way for the rest of their life.
Right. And it's just a nice one-stop shop. All of us have busy lives, and it's like, okay, I got to maintain my teeth, but this thing goes in my mouth. And so instead of going to 2 separate places, just come here and we're going to help you and we're going to take care of it for you.
So then they're going to come back and see you on the
Yep.
medical side probably at least once a year as well, right?
And then, lucky for you, we're going to answer the same questions as you did before. Are you still tired? Are you able to now function, like, doing your daily activities with your kids and your work? Are you less depressed? Are you less anxious? Are you losing weight? Now, do you have enough energy to go exercise?
Right.
Those are the things that, I'm going to ask to make sure that not only are we treating your teeth and the oxygenation, what's the after effect of it? Sometimes you could have, pain in the jaw, and, we can discuss that and treat that as well.
And a lot of patients have like watches and stuff that track
Yeah.
their oxygen. Is that something you ask patients about?
Yeah, I actually also use it. We have to embrace technology as it's coming to, towards
Right.
us. And so patients now wear Apple Watches, they wear Fitbits, they have those Oura Rings. Anything that you have, us as your providers, we love all these like high blood pressure monitoring and oxygenation monitoring, anything that you have that really helps us kind of see a bigger picture, because we're not there with you 24/7.
Now, talking to you guys, I've understood there's like maybe two things you want to look for long term, what we call a side effect or a complication. One was the jaw. Could you just tell us a little bit more about that? Would they get pain or what would happen?
Yeah, sometimes when you have jaw pain, it also creates migraines and headaches.
Got it.
And now you're just kind of spinning like, where is this coming from? For us, we want to make sure that our appliance is not, causing that. And so we would work hand in hand with Joe and Dr. Lynch to make sure that that's not the case, and work with other specialties if it is something else.
And Jan, you were telling me it can also move your teeth sometimes, so you want to be careful that you're watching for that as well.
Yeah, that's definitely something we watch for. The Medicare approved appliance is called a Herbst appliance, and that's also an orthodontic appliance. So we're watching for jaw position, like permanent changes, and teeth movements.
Nice thing that we do here is we do make a morning positioner for the patients. So with a morning appliance, they wear it for about 10 minutes, but that's going to help make sure that their teeth and their jaw go back into place. So that helps minimize teeth movement and also jaw pain.
Wow. And as a pain management doctor, I've been very interested. My understanding, Bea, is this is really common for patients who are taking opioids.
Yeah. So there are two different types of sleep apnea. There's the obstructive sleep apnea that is more common with obesity and the neck circumference we were talking about. There is central sleep apnea where now your brain is not able to tell the right type of signals to the muscles that control your breathing. Why that is important with pain patients is that a lot of our pain patients, they are on opiates.
Yeah.
And opiates can change that functionality in your brain, and now you're not able to breathe because the brain is not sending the right proper signals. And so, we can help kind of guide you in the right type of treatment if you do have that. But for the most part, honestly, patients have mostly obstructive sleep apnea and a little bit of central sleep apnea.
Interesting.
So the oral appliance works well with obstruction because the obstruction is your tongue.
Right.
And so the appliance technology advances the jaw and the tongue out of the airway. Centrals, it can't. That's where CPAP comes into play. So if on the sleep study, the report from the sleep physician would dictate and tell us what is happening with it
Right.
Yeah.
and the best treatment option.
Yeah. So if their collapse is coming from closer to their epiglottis, or if they have central sleep apnea, the oral appliance therapy isn't going to be the best choice.
Right.
This sounds like a pretty incredible program with the three of you guys working together to diagnose and treat these patients that have a disease that honestly can kill them. Yeah. And in your practice, you're able to save lives. That's a pretty exciting thing.
Thank you. Yeah.
We want our patients to breathe and look pretty.
So I feel like I've learned a lot about sleep apnea today. Do you guys have any final thoughts for our viewers?
I think we just kind of want to make it simple. We want for our patients to be able to breathe. If you have any family members or friends, or if you yourself are snoring or suffering from any of the symptoms you're talking about, come to us, talk to us. We'll figure it out from there. Just make it simple. Yeah.
Make it simple. Absolutely.
We streamlined it to make it extremely easy and a one-stop that you don't have to go to many providers.
Well, ladies, thank you so much. I learned so much from you today. And I'll just say to our viewers at home, I think Bea said it best, like, we want you to breathe. I would say that for a lot of patients I've talked to, they don't even realize what they were missing out on in life until they got this condition treated. So if you or someone you know is suffering from sleep apnea, I encourage you to go to our website at azdentist.com and let's handle this condition today.